When you're ready.
My topic I'll be talking about is the transformation and adaptation of celiac. More specifically, the question I conducted my research on was how has celiac disease adapted and transformed the lives of people who have it? The topics I will be covering are what exactly celiac is, which includes what happens to your intestines and what it means for people diagnosed with it. Next, I will be talking about the effects. What happens if it goes undiagnosed, and how it develops and specific risk factors that can increase your chance of getting it. How doctors make a diagnosis, and the mental toll of before and after the diagnosis, and to end the solutions that doctors recommend you use. To begin, what is celiac? Well, celiac disease is an autoimmune condition that damages your intestines and prevents your body from absorbing nutrients. Celiac disease has been increasingly common with a 7.5% increase every year. When diagnosed, you're prescribed to stop eating gluten, which includes wheat, barley, and rye products. But when gluten is ingested, the body's immune system reacts and damages the small intestine's villi. Villi absorb vitamins, minerals, and nutrients from the food consumed. But if the villi is damaged, it prevents the body from obtaining any of the nutrients just consumed. The reason being is because the walls of the intestine become flattened instead of hair-like grooves of the normal person's intestines. Without nutrients, this can cause weight loss, nausea, constipation, and irritability in the body. Untreated celiac disease can have more serious symptoms that include malnutrition, bone weakening, miscarriages, infertility, intestinal lymphoma, small bowel cancer, and nervous system problems. Some of the main reasons celiac disease develops is genes. It is found that if you have either one of these leukocyte antigens, DQ2 or DQ8, then you have a higher chance of developing the disease. The antigens are genetic markers in the immune system that stick to the gluten proteins. About 30% of people have the gene, but only 4% of people develop the disease. The genes are one way to test if you have celiac, but it is also common if a family member has it, you have type 1 diabetes or Down syndrome. And the reason celiac disease has become more prominent today is not because wheat has changed, but because of how wheat is produced. Fast food has become popular, and the food can be highly processed, making the wheaten food much harder to digest, hence the increase of celiac disease over the years. Next, how do doctors diagnose the disease? As you can see in the chart, scientists conducted a test identifying the best way to diagnose celiac disease using 3 antibodies under 5 categories. The antibodies were anti-transglutamase, deaminated gliadin peptides, and anti-endomysium antibodies. The 5 categories they were tested under was sensitivity, specificity, positive predictive value, negative predictive value, and lastly the diagnostic accuracy. They then would use the 4 out of the 5 rule. If you came out positive with 4 or higher, then most likely you have celiac disease, but if you had less than the 4, most likely you would be negative. The antibody that doctors test the most is the anti-transglutaminase, because it is the most accurate with testing celiac. But the trouble doctors run into with serology testing is that they never come out as 100%, leaving room for error. So if you test positive or negative, doctors will recommend you do a biopsy. This includes receiving a sample from your intestines to test and examine the tissue more closely. If the tissue includes white blood cells, inflammation, or damage, then it'll be enough for doctors to diagnose it. While celiac disease transforms people's lives physically, there can be a mental toll on people as well. On average, people with celiac disease test higher than normal people with social anxiety as well as experiencing panic attacks. Another common disorder is depression due to the malabsorption that happens in the intestines that alters the brain. The study found that 37% of women that have celiac disease suffer from clinical depression, and another involving children with depression rates in boys of 8% and girls of 14%. This is why doctors tell their patients to incorporate vitamin B6 to their mood while they recover. Celiac disease can also cause physical issues, including joint pain, stomach pain, and headaches. If patients are constantly in pain, it lowers their physical and social health. According to doctors, people with celiac often avoid social interaction, particularly when they have to eat in front of people. This is linked to the dark side of resilience because it tells us that resilience can be a strength but a bigger weakness. In the article, it talks about how people get scared of rejection and move away from social groups to avoid criticism. And this relates to celiac because people tend to stay away to avoid the criticism and pressure to perform. Not only does the dark side of resilience connect, so does the migrant mother. It shows fear and uncertainty in their lives, and this relates to celiac because with their world changing in the Great Depression, your life is changing as well, and you have to adapt to the new lifestyles. This artifact also shows stress and depression, and both of these characters can and are present of people who have celiac. And finally, the solution. How can one overcome this? Many people want to return to their original diet, but that's just not possible with the sensitivity of your intestines. So for starters, doctors highly recommend a gluten-free diet, and in less severe cases, a gluten-friendly diet. A gluten-free diet includes staying away from wheat products and anything that comes across wheat. In more severe cases, there can be no cross-contamination, or once again, severe pain can happen. Others with less severe cases can stick to a gluten-free diet but have less of a reaction to an accidental contamination or ingestion of gluten. Doctors will also administer steroids in a severe case that gluten is ingested and there is pain. This allows for your intestines to settle, reduce inflammation, and relieve the pain. But in less severe cases, the doctors will tell you over-the-counter medicines or laxatives that will help relieve the pain in some amount of time. And overall, celiac has become much more common and prominent, and doctors have learned quite a bit in diagnosing it.
How did your research question evolve as you moved through the process?
My research question evolved when I started studying the artifacts, the dark side of resilience, because it closely related to diagnosis of the disease. Becoming too resilient can cause isolation, pressure to perform, and staying away from groups of people, and all those relate to the effects of celiac on people. And this helped me build my question because I was then able to explain how people are negatively affected.
Okay, thank you. What are the implications of your findings to the community?
My implications that I found that are helpful is that with these findings we have learned how annoying this disease is and how doctors need to advance their research on how they can treat, possibly make a cure and relieve the pain. And then these implications could also move us in a trend that could diagnose people easier and quicker so that they can minimize the damage being done to their body.